December 6, 2020, 1 p.m. emergency Board of Health meeting. Just like to remind everybody that this meeting is being recorded by video and audio. And pursuant to Governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will do so via Zoom video conferencing. The video conference will be shown on Nantucket's Government TV YouTube page. We are now using Zoom webinar for meetings, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate, and the registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in order that they are raised. If you do not have an audio capable device, the Q&A button can be used to type a question. The YouTube chat will no longer be enabled. Any questions that cannot verbally be asked, use the Q&A function. All questions should be directed through the chair. And for attendance purposes, for the record of the meeting, as I see you, could you just please say that you are here? James Cooper.
Here.
Meredith Lepre.
Here.
Melissa Murphy.
Here.
Malcolm McNabb.
Here.
Roberto Santamaria.
Here.
We also have Dr. Diane Pearl.
Here.
We have the CEO and president of the hospital, Gary Shaw.
Here.
We have town administrator.
Here.
And we also have Elizabeth Hallett, superintendent of the schools.
Here.
Okay, thank you. So I guess I'll turn this right over to Roberto.
Good afternoon. Thank you for having us today in such a short notice. Thank you for meeting. So in the last few days, we have seen a significant spike of cases from the case numbers that are coming back. It has caused a lot of angst in the public, as well as ourselves. When we first wake up and you see that number, it causes a lot of panic. But what's really important to understand is that what we're also seeing is the backlog of cases are also showing up. So when we see that 46 number, it's more than 1 day's worth of testing. So I'll allow the hospital to explain a little bit more about that, but as we go. But what we're really, before I switch it over to them, I just want to really show that we're taking this very seriously. I have a series of recommendations that we can discuss afterwards. I'm not going to be recommending any emergency shutdowns or any changes to our orders right now. It is also important to understand that we are still able to trace the great majority of the cases. And then from there, I will turn it over to Gary and Dr. Pearl, and then we can continue the discussion afterwards. Gary, you're muted.
All right, I think you can hear me now. Thanks, Roberto. Well, just to be clear, when you break down the numbers of what we've seen come in over the last few days, on 12/2, we tested and we reported 6 that came back from those days. On 12/3, we had 44 come back, and on 12/4, we had 44. So the 64 number, when you look at that, seems stunning, but actually it's a combination of those 3 days. So I will say that the broad testing is going extremely well, and Dr. Pearl can speak to that. There does not seem to be a backlog there, but there is a lot of testing going on. And of course, we get impacted by weather from time to time, and our samples don't go out, or we don't test for a day, and then it takes another day for samples to go out and come back. So it's a cumulative number. That in itself, it does put us into a percentage overall that's concerning, and it does tell us that we obviously have the infection, the disease on this island, and we want to be careful about that. So I'll let Dr. Pearl describe what she feels are her concerns and her recommendations from this point.
Thank you. So when we look at the numbers, so first of all, the number that we report every day is the number of test results which have returned in the past 24 hours. It does not reflect a 24-hour period of testing. So it's the number of tests which have returned. And as you people have been talking, it's a combination of several days, perhaps, depending upon how they were sent and when they were received back. But secondly, we have been seeing a number between 10 and 15 a day for a while, I think, until the last 6 or 7 days. And starting on the 30th of November, we tested 283 people, which was our record. And of those, 26 came back positive. So that was a significant increase. Now that's a 10% number for that day. Since that day, we've had 23, and then we had a 35, and then we had this 44 day. And then yesterday, we had 14 positives, and those results are all back. So whether that is the end of this little surge or whether it's a little dip for unknown reasons, we don't know. But as of 237 tests that we sent, 14 positives are the results. And that is a significant drop. We don't know if that's going to be the trend or if that is just a single day. So it is possible that those high numbers were the post-Thanksgiving peak, and we don't know yet. It's always, we have no way of predicting what the next day will show us. So today people lined up at 5 in the morning as they have been doing, and that creates trouble for traffic. It creates anxiety for everybody, and it shows, I guess, how many people are interested in being tested for whatever reason. And we're always perplexed sometimes to see why people want to be tested if they're perfectly well. But the majority today were symptomatic people, mildly symptomatic, with respiratory symptoms, mild, or exposed, known to be exposed to other cases. So there are very valid reasons for testing today. And we got about 140 tests done today on a very short 8 o'clock start, 8 to 12. So we're interested to see where we're heading. None of us know what the future lies. Are we going to drop back to 10 a day? Are we going to see continued increases in numbers? We don't know. But we're open to any questions or any way that we can help the town manage going forward in the safest possible way.
Okay.
So
Questions
one of
for
the things,
Diane?
sorry, Jim.
I was just going to say, any questions for Diane? Meredith?
I'm wondering if we know, I had asked Roberto this earlier, but if we know what our exact cycle number is?
Each test is tested at the Broad, and they use the cycle threshold technique to test every single patient. And so they have an arbitrary positive test, like all medical tests. There is a range which we call normal, and there's a range which we call abnormal, and it's somewhat arbitrarily set according to a bell-shaped curve. And so the cycle threshold begins somewhere and ends somewhere. And in that number, they call those abnormal or positive. And so they either can be a strong positive or a weak positive based upon the cycle threshold. No one in the world knows how to interpret that. And we certainly don't here on Nantucket. The test does not have anything to do with infectivity necessarily, or infectiousness, or communicability. So you might have a positive test because you had the infection a month ago. And these tests only can be used really in a specific clinical situation. If you come in with a fever and you can't smell something suddenly, can't smell anything, and your test is positive, that's probably 100% likely that you have the infection. If you have no symptoms, but you had it last month and you have a positive test, it's likely that you're no longer infectious. But each person, people have to interpret these tests in the situation that they're in. And that's the state of testing at the moment. But they are highly sensitive, Mary, and they will continue to be positive for a long time afterward. And so we don't use that anymore. We use from the time of your infection, 10 days forward. After that, you're not likely to be infectious. And we do not recommend retesting for any reason if you have a positive test. And I have to say that is one of the bits of misinformation. A lot of employers are asking for people to get their test again. And if they return negative, they can come back to work. But we have seen, and science tells us, that you might test positive for many months and you are not infectious. So this is just really, it requires a lot of finesse to interpret these in some cases.
Roberto, did you want to?
No, that's great. No, yeah, I know the cycle threshold is a conversation that you keep hearing a lot on TV, and a lot of articles are coming out here and there discussing cycle thresholds. But the Broad Institute is one of the best in the country, if not the world at that point, at what they do. So I would say let's have faith in our laboratory, and when they claim it positive, let's have faith that it is a positive, and it doesn't help people to say that they think it's a false positive. So one of the things that what's really important for us to show is how what we're still seeing is still household transmission. We're still seeing a lot of just families getting together, people who went to visit, things like that. So I have a really, really quick animation that I made maybe 20 minutes ago of how these sorts of pod situations, these sorts of household things happen. So let me do it real quick and share this PowerPoint. And if it can't, there we go. So what we're seeing is, and of course the animation's not working. I don't know why sorry, just a moment. My apologies. There we go. So what we're seeing with the household with mutual friends and coworkers is that, you may remember this from our previous Board of Health, one of the previous Board of Health meetings, where we showed it how each and every individual pod goes. But what's important is that people aren't always understanding what it is that a pod actually looks like. Your pod is just your household, just the people you're living with. Because as soon as you start interacting, those pods start merging. And eventually, your 1 4-person pod, if they interact with others, then those 4 becomes this. And your pod is now all 12 of those people, even if you've never met them before in your life, because you have that point of intersectionality between all the homes. So it's really easy, and we're going to be getting graphics out, and we're going to be getting more information out there. And this was very rudimentary, but you're going to see that more refined as we go. Sorry about the cat. You're going to be seeing that a little bit more refined moving forward. I'm sorry. And then what's really important to understand is just, even if it is just you going to a friend's house or something like that, you can't necessarily put faith in that everyone else is taking the virus as seriously as everyone in your house is. So it's really important to see that. And I'm going to go put her in another room, so I'll be right back.
Does anybody else want to jump in? Malcolm?
I'll wait for Roberto to come back.
Okay, sorry about that. I just had to make sure that the cat was away.
Meredith?
Do you know the R number?
With today's numbers or yesterday's numbers, no, but I did calculate it for the week from Friday because I was talking with the school committee. The 14-day R number was 1.5. The 7-day R number was 1.7. 1.72 was what it came down to. It did not account for Saturday's numbers, so I will need to recalculate that. But it is dangerously close to that too. Which is when we start getting into exponential growth of the virus in the population. We are seeing very strong spread. The only issue that when I calculate our R number, I do it based on the amount of tests, which does skew higher, because when you do an R number, you have to base it on the whole population. But we have a dynamic population, so I can't necessarily account for our full population and how it's spreading in this population, whether we have 17,000 people or 37,000 people. So I do that off the static number. of the test. So we do skew higher. So 1.72, though it is high, it is a little, I would say, give that a 90% confidence interval of 0.2 to 0.25 on each side, because I can't account for the dynamic population.
Malcolm? Malcolm?
So you said before, Roberto, you're not recommending any further restrictions?
Yeah, as of right now, we're not recommending further restrictions. We do still have we do have some pretty strong suggestions that I can probably go through right now because of that. But what we're seeing is we're still in that roller coaster of cases where, as you may have as we discussed earlier, where we go really high some days, really low some days, not necessarily just because of the backlog. So in order to work together to get this, what we're hoping is that people start, my 5 recommendations right now is that, number one, most important part, the governor's order to the stay-at-home order is still in effect. We never left that. So we need to start moving towards back towards that stay-at-home order and discussing that more in depthly. When people are out there, we have to assume we already have it and adhere to isolation and quarantine orders. We have a task force that we're working on, an enforcement task force that's going to be multi-jurisdictional, everything from the building department to police and fire, and as well as health. And that task force is going to be doing things like enforcing at job sites as well, enforcing at other locations, things like gatherings and parties and stuff. But also in my staff, we're also going to be more aggressively enforcing quarantines and isolation. I get the list of those who are supposed to be in quarantine from the state. And then we're encouraging retail and restaurants to go online and call in ordering as much as possible to avoid extended interactions. For those who don't want to cook at home, or if they want to go out to eat, we're asking people to order takeout, delivery, or curbside. If you go out and sit down, you are increasing your interaction and exposure. Even though we're not seeing exposures happening at restaurants, when we do contact tracing, when we do information, we're not actually seeing that happening at restaurants. It is still important that to understand that going out to eat, even if you are going straight to the restaurant and back, you're still interacting with people along the way. You're interacting with people out there. So that's the sort of situation we run into. And then the other part of the governor's orders that we all still have to understand is that the governor's orders does require that workplaces have a maximum occupancy of 50%. And if your occupancy is still larger than the maximum of 10 people per 1,000 square feet. So we're asking employers to have people work from home as much as possible, because we're drifting, to use the MGB words, we're drifting from adherence. That 50% occupancy level, we know it works. We're not seeing wide scale spread at the schools because the schools are at 50% occupancy and doing distancing and doing masks. So we're not seeing widespread there. We know these mitigation standards work. We need to now start going back to that more aggressive enforcement where we were. The orders we have in place work. We know they work. It's just a matter of getting people to get back on track, to stop drifting from the line.
Malcolm?
Yeah. I have some notes here. Everything's breaking up. So if you don't hear me, you might get every other word I say. But I need to understand some logic here. We have an R number. We really don't know what it is, but it may be close to 2. We had more restrictions early on when we had virtually no cases at all. Now we have a lot of cases. We've loosened up a fair bit. And we used to have this number, and I used to tell people this, and it was reported at meetings that when we got above 10%, it would be time to go back to more restrictive times. And I looked this morning and it was 11.6 for the last 7 days. So are we following it, or are we changing the rules? And that concerns me a little bit. And I know you say you can do tracing, but Massachusetts, so at some point, is that going to get out of control? So we're above 10%, we're close to an R number. I have a sense that tracing may become important. And while these are all little pods, all you need is one person to slip out of a pod. You showed that very well in your graphics. So, I mean, I always thought that public health really was prevention and not reactive. And I'm just a little concerned we may not be doing enough. And I'm also confused about some of the orders. If we have a stay-at-home order, why are restaurants still open? Why are shops still open? If you're supposed to be home, you shouldn't be going into those places. So I need some clarification, because listen, the hospital's doing a great job and Roberto's doing a great job. You talked about this spike. I don't want to see us go like that way up. We're going, 11%, 12%, 13%. I want to get ahead of it. And I just need confidence that we're going to be ahead of it and we're being preventive and not reactive.
So absolutely, there are a few things there. When I said the stay-at-home order, I did use a semantic mistake. It was a stay-at-home advisory from the governor. It's not an order, so that is my mistake in the words.
Yeah, I think it's safer at home.
Yeah, safer at home is what they called it. So it is important that we need to pay attention to that safer at home advisory. When we set the 10% threshold, you're absolutely right. We did say 10% was the time to go back and to start rolling things back. And I think we latched onto that number a little bit too hard, because what I'm seeing with these cases and these spikes is a self-selection bias. The people who are showing up to the symptomatic line are more likely to be sick. So we are seeing a skew we're seeing a bias to the higher positivity rate. And then with those who are taking advantage of some of the asymptomatic testing right now, because they're taking it for purpose, a lot of times they're taking these exams for purposes of travel, we're also seeing a selection bias towards those who are willing to take more risky behaviors. So those who are abiding by the safer at home order, those who are abiding by the others, haven't been getting tested because they have had no reason to either be a contact, they haven't been contacted through contact tracing, or they're not showing symptoms as well. So we are removing that section of the population from our testing pool. So we're seeing kind of a pretty big skew of selection bias, and it's something I didn't account for when I was talking about that 10% threshold.
Well, I understand that, and I understand the selection bias. It's somehow what happens to our credibility if we've been saying it's 10% is the magic number, and now that we're 11%, and we avoiding it? Are we changing the rules on us? And do we need a stay-at-home order on Nantucket until we see that we actually are going down and not going up?
Yeah.
Gary first.
Yeah, Malcolm, I think those are great points. As we were navigating a growth of knowledge in this, we started to understand where we would see patients most at risk, that would get an infection that was more likely to be of concern. And we know that that's of an age group that's older and to some degree a very young age group. And what we're seeing right now are patterns where the largest groups of infectivity that we're seeing are in the 20s to 40s, I would say. And we're seeing very few on either end that we would be concerned about. And what we've been saying from the beginning is let's not be overwhelmed as a community. so that your hospital can continue working to provide services. And let's learn as we go related to where we would want to follow these particular cases to see what kind of tracking might be necessary, other orders from the town to help us slow things down. And so the evolution of picking a number, 10% way back in the early day was kind of throwing a dart at the dartboard to say, maybe that 10% is when we really start a serious discussion around what do we learn and what do we know? And I think that's where we are. We know that the retail shops are not contributing to this. We know that the restaurants have not been contributing to this. We do know that densely packed homes are contributing to this, and that people are continuing to work because they have to work. And then they're seeing their families come down with an illness, and then they quarantine, and then they see the wife come down with it a week later, and then 5 days later, they see the husband come down with it. And so we see this constant escalation in these densely packed homes that is concerning. Primarily, you're seeing some of this in the trades because that's where individuals in the more densely packed homes are employed. But we have not been seeing, fortunately, those case numbers that are coming into the cottage hospital that would require us to do a gross number of medevacs or hospitalizations. So I'd ask Dr. Pearl to speak to that bandwidth and the knowledge around this, and then let's talk about following the science and where it leads us to focus on an illness to protect a community. So Diane, what would be your thoughts?
My initial thought, Gary, is that what we know now as compared to what we knew in April and June, May, June, when we were talking about this and this 10%, which was highly theoretical at that point, now is real. And the reality is that in the asymptomatic people who come in through Stop the Spread, we find extremely low numbers of positive tests. And in fact, the positive ones we do have been tested because they're arriving from travel into our state from other areas, or some other reasons that they've chosen to be tested. But in a general person who has no symptoms, no exposure, coming in to be tested, it would be extremely unlikely to find a positive test in that group. And so we know that these positive tests are confined in general to certain demographics and certain reasons. There are a few people who've shown up with no exposure, but it's quite rare. So instead of reacting in a very aggressive way that might be harmful to people in our community, we should choose our response, and that's your job, of course, but choose the response that would benefit the most people and harm the fewest. And so that's a big job for all of you to consider, all of these parts and pieces of this medical pandemic. So.
Yeah, but to build on that, we didn't have much testing at the very beginning of this, and we felt that if we got to 10% at some point, it would be based on current availability of testing. With limited numbers, that could be concerning. And then we decided that the best way to understand where this was in the community and to follow it was to have as much testing as possible as it came online. So that just created the density of a pool that's huge and gives us a better statistical understanding of how severe illness is moving, where it's at, should we be concerned. And so we're in a much better place with a higher number of testing and finding positives rather than being reactive to what shows up on our doorstep and not knowing because we had limited testing. And that's my worry about the coast and other places that haven't been able to be as successful in getting testing resources available. So I think it makes that 10% number kind of arbitrary, but it does make us aware of where we're following and tracking individuals and, how is contact tracing working? When you get a number of 44 in a day, that's concerning when you have Elizabeth Harris, one person that we have working for a blend with the health department in the hospital, trying to make those phone calls. But what we're doing now is we're spreading those amongst the other medical personnel at the cottage hospital, the other nurses, and being able to track that back and then putting that into the collaborative for tracking. So we've still continued to be very successful with that and meet the needs to get something out quickly to individuals to help them understand what they're facing. But it's the severity of illness that I would be worried about.
Can you, excuse me again, going back to tracing, do you feel comfortable that we're to keep up with it? I mean, Roberto's little slide would show, one or two people get out of the pod and get missed, and we have a very big pod. The whole island becomes a pod. Our whole strategy essentially has been relying on contact tracing, finding the cases. Are we comfortable we can still do that, or at one point is this going to get away from us?
Well, I would answer that, Malcolm, with I'm confident that we have the resources to give the information back to people that we find are positive. So contacting them relatively quickly is occurring. And then we're asking them to isolate. And we hope that they do that successfully. And we're finding that they don't always do that. And then being able to get the tracing collaborative to call and find out about other contacts and help people decide where that might be moving, is obviously what we want to see happen. With the large number of contacts that are occurring across the state and the collaborative working on it, they've been flexing up and down related to whether 1 week they're doing it really well and the next week they're not doing it as well, because it's not a fun job when people move and get out of those roles. So I would say that the resources ebb and flow in that, but still we're seeing that information is getting out and tracing seems to be working. But a lot of responsibility is on the individual that is identified as positive and isolating. If they don't do that, that's what puts our community more at risk. The tracing, I do think, is working. But Roberta, what would you reflect on that?
I would reflect that, yes, the tracing is working. And when we do random checks, when I have one of my inspectors do random checks on general quarantine, people are paying attention. It's just those few that aren't that is hard to catch every once in a while. And unfortunately, there is no, without a court order, there is no law that we can pass or a regulation that we can pass that requires fining for breaking quarantine until we get, we will need town council and things like that to do that, to confine somebody to their house legally. So unfortunately, we do still have to ask, which is why it's become a very difficult situation. But we are randomly checking on quarantine, and we're stepping that up this week. We're going to be stepping that up significantly.
Maybe a little discussion around the fundamentals of what the expectations are, because we've seen illness across the country, and we see people that get illness and infection, and they're not very symptomatic. And we're seeing that a large proportion of the individuals on this island would get infected, and they're really not that symptomatic, if any symptoms at all. And so when that occurs, you get this drift sense that is really hard to get your arms around, because you would say, I'm a family of 5. Well, I got it. I really wasn't that sick. And okay, now my daughter's got it and she's really not that ill. And yet I keep hearing the public health officials in the hospital say, stay at home, quarantine. And what's really just not that serious of an issue. And so when you get a mindset, I think, that starts to develop around what they're seeing their neighbors feel like in response to an illness, how they've felt in response to an illness, they start to forget that the reason that we're asking people to quarantine and stay at home is it's that proportion of infection and the higher number of those at risk, or the lower number of those at risk, that we're trying to protect, because we know that the highest percentage of people that are ill are really not that ill. It's the 10% on either end that we're looking at that can be very significantly able to overrun a hospital and a community. So it's a challenge to get the fundamentals understood again, to say we all have a responsibility right now to behave as if we have COVID. Well, that sounds odd when you would say, but I can still go to a grocery store, or I can still go to a restaurant. But what we're saying is, if you were acting as if you had COVID, you'd self-select probably not to do some of that. You'd self-select to be farther away from people more often, and look at your fellow man as, okay, I have to protect somebody that I know if I run into them and I was infected, I would probably make them a risk factor. And that's what we want the community to be thinking, to be aware, to self-select, to step backwards and say, it's time to just be distant a little bit. And do that for a period of time, to let these vaccines come in and start to have an impact.
And I would just say, Gary, that not only should we behave as if we have the infection ourselves, but behave as if everyone else has it. And then we can keep distant, and it would be hard to infect you if you didn't put yourself in the situation that you were too close to somebody for an extended period of time and none of you were wearing masks. And if you protect yourself with those standards, and the other person is protecting you, we know that those strategies do work to prevent.
Well, they work, but that assumes a great deal about human nature. And
Yes.
I'm not sure that everybody, you speak well and your message is very clear, but I'm not sure everyone, I think everyone hears it, but not everyone will follow it. I'm just very concerned that at some point, we're going to get behind that curve.
Mm.
And I understand reluctance to have more regulations. I was just curious what the rest of the board thinks.
Meredith?
I'm very seriously concerned about contact tracing because in my experience, I've had multiple people come to me and it has been somebody was 2 weeks, they were already back at work and they got a phone call about contact tracing. Another person has been positive for over a week, never got a phone call. I don't think that it is happening the way that we all think it is happening. And I'm not like, I think Elizabeth Harris is doing a wonderful job. I think the hospital is doing a great job. I heard that now the nurses are allowed to give positive results. They did work to make sure the kids 13 to 17 whose parents couldn't access their results can now access their results so that they can return to school. All of that is wonderful. I just think that the sheer number, and I'm wondering, we have people on this island that can help us do it. I have been doing contact tracing at the school all week. It is not something that requires an enormous amount of higher level thinking. I think you have to really just ask people questions. And I went to a webinar this week where they give you the sheet that they use to ask the question. So I just don't know if maybe we can get more people here doing it, if it's through the town or through the hospital. But I mean, CTC is not doing it. And I think with a number of 64, they're going to get to it in a month with the numbers happening in the state. I'm also very concerned that, school is closed, and what is most important in our community? Are our children important to us? Do we value them? Because I think if we value them, then we're going to shut down some other things so that our kids can go to school. Because I think they've been out of school a lot since March, and we're not really making them a priority if we think it's more important to go out to eat at a restaurant.
Melissa?
We do have, yes, thank you. I think early on we did train some local contact tracers, Mary, to your point, and I think that we should consider that because I think it might be faster than the state resources, which are overburdened. And I just wanted to share an anecdote from early on when one of our patients was infected in, I think, April, a young woman, and she decided to blast it on her Facebook page because that way she could contact trace all of her own people. And she would just put out there that I have this infection. And if you've been with me in the past week or two, I just want to let you know. And I thought it was a really wonderful thing for this young woman to do. Most other people consider it a little bit shameful, or they don't want the word to get out or something. So contact tracing is done blindly, but we really would love to remove that barrier and have people contact their own friends and family, say, oh my gosh, I've got a positive test. That is a really helpful tool for honesty and good health for the community, and it would really be helpful. So we would like to remove the stigma because people feel stigmatized by this still.
Thank you so much. And Meredith, I agree with you on the concerns about contact tracing. And Diane, I thought I had remembered in the early days hearing that we had maybe a group of 30 or so volunteers helping with contact tracing. So anything we can do, I think, locally to take back some control from that. I mean, obviously, we know the state is seeing surges on par, if not ahead of where we are as a community. So relying on the state coalition to help us with contact tracing just seems to bury us deeper in the hole. I have several comments, Steve, and several questions. And so I'm happy to go through. And if you think I've asked too many, just tell me to stop. Before I go into the questions, Roberto, I do appreciate your recommendations. And I agree with them. I have concerns about quote unquote rolling back to a shutdown because unlike April and May and June, we don't have economic support for community members on the state and federal level to support our families who would then be out of work. And that's very concerning to me. I heard very often trading one public health crisis for another early on. And I think that's even more true today than it was then, because we don't have federal stimulus packages. I mean, apparently one is on the horizon, but who the heck knows what's going to happen with that. So my concern there lies with balancing not the economic health of our families so much, but the fallout of economic insecurity of our families if we were to roll back, and not having supports in place to care for our community members who would be facing unemployment, food shortage, rent shortage, mortgage in support, things like that. So I'm going to speak right now as just a community member who happens to have been elected to wear a select board and Board of Health hat. And I'm going to somewhat emotionally plea to our community members. You know, when you ask people why they want to live on Nantucket, what they think is so special about it, every single person you ask says, the community. We are renowned for being a fabulously caring and considerate community. And we need to start behaving in that manner immediately. Going out to eat is a choice. Going out to eat with people who are not in our home is a choice, and it's a choice that puts other people at risk. I have gone out to eat 3 times in the past 6 weeks, and has only been with my husband, who I live with. And it's a very conscious choice. I very much miss going out with my friends. I miss gathering with them. I miss the social aspects, but it is my responsibility to put that to the side to care for my community members. And so, to reiterate what Roberto said, your pod is who you live with. There is no other pod. There is no, I'm gathering safely with this group. Particularly right now, maybe a few months ago when we felt lulled into a sense that the virus load wasn't so high, it felt safer, but it is not safe right now. Play dates are not okay. Traveling to visit family and friends is not okay. It's not safe. And it may ultimately make you feel safe or make me feel safe if I get tested before I travel. But as we're seeing, it's a false sense of security. And my greatest concern is that while right now we also are lulled into a sense of security that perhaps it's just 20 to 40-year-olds and the virus load's not so severe, what if our Stop and Shop has to close because of a widespread infection? That will affect our food supply. We're seeing it affect our children every day. And I agree with you, Meredith. I think that we have to make choices to put our community and our children ahead of just about everything. And that's a very difficult balance. And I understand it. And I think all of us are at this table who do. I think that the fact that the government has not told us or has not shut down industry should not be mistaken for the fact that they're safe, and that we can't shut down travel. That does not make traveling safe. We're not shutting down restaurants or indoor dining. That does not make dining with a group of friends safe. And I think we have to wake up or sort of snap out of that false sense of security that because the government hasn't told us to stop doing it yet, that it's okay to do. So I am imploring our community members to take those recommendations, to stay home, for employers that can, to please encourage your employees to work remotely wherever and whenever possible. If you've got job sites that you're managing, please, please, even less than 6 people. 6 might be the top, but if you can do it with less, please consider doing it. Anything we can do as a community to stop that cross intersection of possible contamination or possible virus spread, it's up to each and every one of us to do. So I also have a couple of questions that, if I can, Steve, ask at this point. And I think some of them, if it's okay, Stephen, through you, would be to Beth Hallett, because they are around the school. And could you please let us know what metrics you'll be using or evaluating or in conversation with Roberto about how to reopen the schools? What are you looking for to make it safe for kids to go back to in-school learning?
Thank you very much. Through the chair, if I may, it's so of course, this is new territory for anyone, especially for a superintendent without a lot of medical knowledge and history. So I really do rely on Roberto and Gary and Dr. Pearl and other health professionals to share the information, to give us advice, to give some predictions, things like that. So we are definitely looking at the daily positivity rates. We're looking at what we see with regard to contact tracing, with regard to student and staff infection, whether there is student and staff infection. We're looking at, and Mary, you can jump in too. We're looking at what's happening within the schools, and again, our protocols in the schools have been really, in a way, what has allowed us to remain open. We have strong health protocols with distancing, with mask wearing, and that has allowed us to keep in-person learning. The recent shutdown, so to speak, of in-person learning was basically because of an elevated number of cases in the community without the ability to complete contact tracing in a manageable time. So without knowing who is coming to school that may have needed to be isolated or quarantined because of a positive contact, that was the reason more than anything to stop and head to remote learning. Returning, my hope is, again, a lower case rate, lower numbers with regard to what we're seeing in the schools. Right now, I'm sure what we are seeing is a response to the Thanksgiving travel. Again, some of the same pieces that we're hearing about with dense households, et cetera. But we will be determining what will happen, or what we will do after December 14th as this week continues and progresses. It's challenging because a call can be made and then things change right away. So it is much of a roulette wheel as I've ever wanted to be on. So, so I thank both Roberto and Gary, and certainly Mary and the Nantucket Public Schools nurses, who have been invaluable in this, in figuring out what next steps are going to be, and contact tracing, and working with staff. And so I hope that answers your question a little bit to that.
It does. And I'm sorry, Mary.
I was going to say, and we have not, that we know of, seen in-school spread. It has been, the 4 school nurses, well, 5 of us, all talk just about every single day, and have been calling people and reaching out to any staff that would have been exposed. So I think the 6 feet has really saved us, because if kids are sitting in their desk all day, the kids around them that are six feet away are not considered exposures. So I think things in the school have been going really well. I think that what is going on outside of the school is really what's affecting us. And it just really upsets me that we're not taking a stand to put our students first, because I think their learning has been interrupted enough. And if we're at 11%, if we're not gonna take a stand to say, let's put a stop to this, I think that's really a mistake.
Just as a follow-up to that, thank you. So am I hearing that an improvement in contact tracing being more effective would give you a sense of security of bringing students back? So if we could mobilize that and we were calling people within 24 hours, it would give you a greater sense of safety. Is that correct?
Yes, absolutely. It is much easier for us when we know whether we need to ask people to isolate, when we need to do our own contact tracing within the building, if we know that someone has had exposure. That's really important. What is challenging is when we don't know, and when we also are trying very hard to explain to all of our families, some of whom are non-English speakers, that it is incredibly important to stay home while you are waiting for test results. So that is another piece. Of quarantine piece is really key. And there's a false sense of security that people feel when they are not symptomatic, yet they are waiting for a test result, either from a travel situation or stop the spread or something like that. Whereas they may come to school or send a child to school and then we discover later that there is positivity in the household. So that's a challenge. Yes, having more contact tracing would certainly give us more a sense of security to be able to keep schools open. So having that would certainly help.
Okay, thank you. And another question that I have is, I guess, directed to Roberto. Is there more we can do as a Board of Health and locally to reinforce the state's travel order? Because my concern is that there's the state travel order, people are registering, there's the threat of a $500 fine, but that clearly didn't stop people from traveling while being infected over Thanksgiving. And I'm thinking, to Meredith's point, what are some things we can do to be proactive before Christmas holiday, which may not be as much of a travel holiday nationally, but it is still a big holiday. Is there more we can do?
It depends on what we're looking at when you discuss what a shutdown looks like. Because when people come to me and they say, we need to shut down the island, what does it look like to you? Because when we talk about shutdowns, there's everything from full, complete, and total closure of all businesses, which is not what we're looking to do. There is also moving things to curbside delivery and nobody inside retail and nobody inside restaurants, which only punishes them for things that they're not contributing to. So there are definitely ways of looking into adding more restrictions. But what is the end game that we're looking for? If it's strictly to stop the infection at the expense of everything else, that's a dangerous response as well.
My question, though, Roberto, was more about the travel order. Is there more we can do locally to enforce that specific travel order? For example, when that travel order was implemented by the state, and I have a property management company, and we had people with reservations to come in and stay at our properties, I took it upon myself to ask them for proof of their negative test result or a signed commitment to quarantine for 14 days before I would give them the keys to the house. And then when I started to see that other agencies weren't doing the same thing, or that wasn't my responsibility, I let that go. So I'm wondering if, as a Board of Health, there's something more we can do to put some more responsibility locally into following that information or tracking that information as a way of enforcement of the order.
We are using the travel order as it is. The only issue is it's the same issue with the testing, is that it's a self-selection bias. people who are filling out the travel forms and doing that are more likely to be paying attention to the rules, because that's the rule. They know that it's nearly impossible for anyone, any municipality, any government agency to control movement between borders, between towns, between, even in some, because we have a customs agency, we can control between government countries, but we can't control interstate travel, and that's nearly impossible. The more we can do as far as the travel order goes is get more information out there, but short of putting somebody at all the points of entry asking for papers every time they come in, which is logistically impossible with what we have. I'm open to suggestions.
Libby?
I was just going to say, maybe in answer to that, and Roberto, maybe one of the things our task force could do is go to lodging establishments and request to look at their travel forms, which people are supposed to be sending there, and do a full check, a little audit of that. There may be things like that, Melissa, that could potentially be done, and maybe even places like not just a hotel or a guest house, but a place that I don't know if we can get it from realtors. I'm sort of thinking out loud here.
Yeah.
But maybe there are some things like that we could set the task force onto.
I'd be happy to work with you to explore that, because I think that it's a really small but important way that we can use our teeth, so to speak. And I recognize there's some logistical issues with using our teeth in some ways, but this may be a low-hanging fruit way that we say locally, you must require the form and you must see proof of a negative test result before they come on island. Now, I also understand that people can get the virus while they're traveling, get here, and there's that complication, but it shouldn't be. We can make it a little bit more challenging to do it. And I think that may be a natural deterrent. I would be very interested to hear Meredith's ideas on what kind of shutdowns seem to make sense, because I think globally, like you were suggesting, Roberto, saying let's shut it down. I think if we're going to actually debate the merits of doing anything like that, we need to know specifically what members are thinking about considering. And that's all for me right now. Thank you.
I didn't have anything in specific. I was using restaurants as an example, but I really think we need to look at where it's coming from. And I know it's coming from specific families, but like, I guess what industry is it coming from? And talk about maybe scaling that back, because we obviously something I think needs to be done. I mean, we're out of school again, and that's really not ideal. So what can we as a town do to make it so that our students are a priority? And maybe some of the other things, I know I thought there was just a community grant. Somebody got a community grant to help. There's places helping with rental assistance, to help with food, to help with heat. So, I mean, I think we need to explore helping people if they need it, if they're in the industry that needs to be shut down.
But I think we just heard that it's not industry specific. It's not related to restaurants. It's not related to retail. That there are already enforcements on the trades, and that what we're seeing is household spread caused by either crowded housing situations or people gathering. And that we cannot legislate or do more enforcement of. And I, for one, am very reticent to quickly lean on the community foundation and the generosity of their donors, because that money will run out very quickly if we start to penalize industries that are not causing the spread. But if I misheard that, I'm happy to be wrong.
Malcolm?
You're muted, Malcolm.
Thank you. I think the point is not industry spreading it or restaurants spreading it or stores spreading it. It's people that are spreading it. And for all our great talk, there are going to be people that are not going to follow the rules, are going to be selfish and think of themselves. So, I mean, if there was support, I would go back to mandatory stay-at-home order. I'm sorry, to be able to manage everyone's personal activity.
Jimmy?
This is for Roberto. Roberto, if the restaurants aren't doing it and the retail isn't doing it, and you say a lot of the big numbers are coming from big gatherings that people are having, is there any way the town can strengthen squeeze that to say that in order to have a gathering of more than so many people, you must get a permit from the town? I mean, we can only do things that we have the right to do. And I think gatherings is one of the biggest problems. If you say most of these cases are coming from people in homes, I understand that, but I don't see how you can do anything with that. But private gatherings is something I think that we could use to maybe lessen the load for some of these cases. Is there anything that we can do permit-wise for that?
Well, we already do that. Whenever there's a large event, things like that, they have to pull those, pull like alcohol pouring licenses, things like that. All gatherings above 10 are already a no-go. So, for example, yesterday we had inspectors go out and check on a gathering that was found on social media. And when they got there, there was only 6 people there, which is actually nothing wrong. It does not run afoul of the orders, but it's still dangerous enough because it was people from like 3 different households. It was 3 couples. So it was actually really difficult. It's actually really difficult, but we already permit large scale gatherings, but we've been enforcing, as we find out about them, we've been enforcing the 10-person gathering order.
Why can't we stop permitting large gatherings? Why can't we just do away with them?
We have stopped them.
Around 10.
Anything above 10, we've stopped. We've stopped it all.
All right, thank you.
Melissa?
Thank you, Steve. Through you, Jimmy, I think that I agree with you. And when we talk about personal responsibility, I think this is what we're talking about, is that government has not said or has said getting together with less than 10 people is quote unquote okay. But in practical reality, when you're a community facing a surge that's causing your public schools to close and causing numbers to rise, it is irresponsible to do so. And that irresponsibility lies squarely on personal responsibility. Perhaps to Malcolm's point, a stay-at-home order is what's necessary, and that will have an impact. I'm not sure what that means exactly, Malcolm, so I'd be curious to hear more about it. But how do we tell people that they have to, I mean, one thing I've heard is if you go to work in the morning, do your job safely, go home, stop at the grocery store quickly, distantly, if you need to, and go home. If that's your day with the people who you live with, we can get through this. It's when we start adding play dates or And, you know, I just want to say something to all the parents who are listening to this. My heart goes out to you. I'm very lucky that my children are older and not school aged, but I know the mental health challenges that and the impact this is having on our students. They are not okay. And particularly our families with special needs students who are having to juggle working remotely with their care, or students receiving physical therapy via Zoom. It is not the same thing. And so I don't know what stay at home means to strengthen that, but it's another example, Jimmy, that we've said less than 10. And so some people hear that and say, okay, well, there's 4 in my house and there's 3 in this house and, you know, 2 over here. So let's all get together. And that's not what that means. And perhaps people just don't understand that. I don't know.
So as a board, there's nothing we can really do about that. That's going to be a personal choice from everybody that they make on their own.
We can't legislate people's lives.
Meredith?
But can we have somebody walking around town? I happened to be in town on Wednesday and I saw the guys fixing the road on North Water Street not wearing masks. I had to ask them to put their masks on. I had 4 people run by me not wearing masks. I asked them to put masks on. One of them just kept running and said, it's 6 feet, and just kept running, some girl in her 20s. So, I mean, people aren't wearing masks and they literally ran right by the town building. So like, and by a police officer, like, I don't understand. And I saw last Friday 2 painters up on a ladder standing a house on South Water Street, not wearing masks. And I said, you need to please put masks on. And they looked at me like I had 10 heads. And I said, well, I'm on the Board of Health and I can see where you work because you're wearing the sweatshirt and you have it on your van. And then they put it on. And when I walked away, they took it off because I drove by again. So like, I'm not sure how much clearer we need to be, other than those people all should have gotten tickets.
The painters did get tickets. We gave them a $900 ticket.
Thank you very much.
But what's really tough about the people walking downtown. So there is very specific methodology that needs to be done with the specific authorities in order to be able to ask somebody for their identification. And the only people who can do that are police under very specific issues. Not wearing a mask while running is not something a police officer can stop them for. And that's, it becomes a real issue. So what we're doing is, as we can, and as we can get, so as we're figuring out who people are, we are issuing these tickets. But yeah, when we see it, we try to enforce it as much as possible. I got told to F off on Friday by a person taking her kid to the bathroom without wearing masks. She said F you and ran into the bathroom. So that, because I couldn't chase her in there. So it's like, that's the type of stuff that ends up happening, and we can't just sit there and wait until the person comes out of the bathroom, because that's not a good use of time. And then when we saw that same person later, when I left for lunch, she was wearing a mask. So it's really difficult is what we're running into. But when we do see, we've gotten past the education portion for people like the painters that you saw. So I walked right up to them and I told them, look, I snapped a picture and I told them, you're getting a ticket. And if you want to fight it, but this is what we're seeing. So we are out there enforcing. We get a report from Plus every time their inspector is out, and then we're out there enforcing as well in my department. And I know Natural Resources is out too, and Fire is now out as well, and police is doing what they can as well.
Jimmy?
So Roberto, as a health department and Dr. Pearl and the hospital and the Board of Health, right now, what can we do?
We can actually do a lot, but there is definitely, it's what's the level we want to go to.
Well, let's hear some of that.
So we can order any of those suggestions that I made earlier. Right now, I want to do those as just recommended. I want those to be just recommendations, things like curbside delivery, no in-person retail, things like that. But those can all be ordered. We can put limitations on specific industries. All of these are there. But it just depends. It's a vote of the board. It's exactly what you want to do. Dr. Pearl, Gary, any other ideas?
But my question, all right, so let me continue then. If retail is doing their job, and I honestly believe they are, and if the building people are doing their job, and I honestly believe they are, so if those are two problems are out of the way, then we have to start finding where the problem actually is, other than people just refusing to wear their masks. And I think that's the biggest problem. And we all see it all day long. And, you know, and you talk to people and they say, okay. And then, you know, like Meredith said, you walk away and they take it off. So I don't know, we can't control those people. So we need to do something that we have control over. And if it's drastic, then it has to be drastic.
Well, we're definitely increasing our enforcement this week with that new task force, where we're going to be going out enforcing a lot harder than we have been. But if you want something more drastic, it has to be a vote as an emergency order by the board.
How does the rest of the board feel on that?
Myself personally, I would go with just the recommendations at this point and see what this next week brings us. Anybody else, Melissa?
Can we do a local order, you know, as opposed to a request to not commingle households? I mean, and you know, I've said before that I have a difficult time approving orders that we can't necessarily enforce, but perhaps with maybe if government says you're not supposed to do it, we can put something like that together. I haven't totally thought this through. I'm a little bit riffing.
We can put in the recommendations kind of like as a resolution. But when it comes to commingling houses, that's impossible. Everything from joint custody, where a child has to get brought to 2 different homes, that's you're now commingling 2 houses. Everything, you know, things like our carpool for school, that's technically commingling a house. So we can do it as resolutions for as a recommendation, but I don't think we can do it as an order. And I would suggest that any orders that we look into, we should probably go to town council first in order to even address any of its legality.
Melissa?
Thank you, Steve. Roberto, I would like to see your recommendations that you've talked about and that kind of resolution, if you will, put out. I know that Florencia from the town administration has done such a great job with graphics. I think oftentimes what's missed for us is it's very confusing for community members to keep track of what's our rule? What's the state rule? Like, what's the current rule? And so if as soon as we can to get those recommendations out so that we can start sharing them within the industries, and, you know, maybe perhaps through Dr. Hallett, through the schools, as quickly as we can do that, I think is important. I know a lot of people are watching this meeting today, but again, just summarizing for them what we're talking about. And, you know, I know that the enforcement task force is somewhat of a new evolution, but I, for one, would love to see some kind of report from you to this board on that and how it's working. Or anyone in your department can write it, because I know you're very busy, but, you know, just the efficacy of that report and of that initiative and how it's working. I have received feedback from people that the enforcement we've been doing, although it's been stepped up in the trades, is still just not working. And I think that's demonstrated by, you know, you and Meredith's stories. And I'm also very reticent to shut down trades, but I also am just really concerned that there are people with flagrant behavior that is, they're bringing the virus home, and that's concerning to me.
I just wanted to let you know that you have 2 public hands raised. I don't know what time, when you want to take public comment.
Yeah, Steve, there's 2. So whenever you're up for it.
I'm sorry, did you recognize me?
Yeah, I thought you raised your hand.
I'm sorry, but I'm getting a lot of flickering here. I'll just say one more thing. I'm a little concerned, and I think Diane put it very well when she said, we really don't know what will happen next. And I don't want to wait until the point where we're scrambling around at the last minute. I also don't want to be in a position where we do something that we don't have to do. The whole problem with this whole thing is there's no book, there's no regulations, there's no textbook to go to. And I'm getting a little concerned too that we have these meetings and we just talk and talk and talk and talk, which is, I guess, very good. It gets people things off their chest, but I'm not sure we've accomplished much or done anything. We've done a little bit better in educating the community about their personal responsibility, which is good. I'm still very leaning to the point that if in the next couple of days, we recommend we get back together again and do a little bit of a shutdown, which would mean you talked about recommending curbside pickup. That's essentially telling people they can't go in the establishment and make it more formal, or a stay-at-home order. I will back off today, being more aggressive, but I think we should be ready to meet in 2 or 3 days again. And let's just not talk forever next time. Let's actually do something. Thank you.
We do have a meeting the 8th.
That's too far from now.
It's Tuesday.
The 8th meeting is the joint meeting with the select board, and I think
Yeah, that's a different topic.
Yeah, I don't think we should.
That's PFAS. That's going to be that's going to be an emotional, controversial meeting anyway. So let's not get it too complicated.
So, Steve, did you want to recognize any of the public comment?
Yeah.
Michael, you're up.
Okay, hi, can people hear me?
Yes, we can hear you. Yes.
Great, thanks. So I guess I have a question and a comment. And my question is in regard to the school management of COVID. So Steve, maybe I'm addressing this to Elizabeth through you. I'd like to say first, I understand and applaud the staff's attempt to deal with the fluctuations that we're all going through. But I've also learned as a special needs social worker in schools myself, that dealing with learning and behavior that often clear limits are ultimately more useful, even though they're maybe initially frustrating. And so in that regard, I wonder why the school is not implementing a protocol other communities in the state are, specifically going remote until 2 weeks after the holidays, which effectively has the school community quarantine and provide as clear a time frame as possible. I know that's a longer period of time, but I would encourage the school to consider this as well as differentiating instruction in general, because I think I've heard even today that people are using the terms remote learning and not being in school interchangeably. And that's just not the case. Although parents may not prefer remote learning, it is a viable strategy for many of our students. And I think that it would make sense to plan for meeting the social, emotional, and technology needs of kids, families, and teachers if we took as a given that there will be a larger block of remote learning happening, and maybe multiple blocks until this pandemic is finished. Failing that, we will end up being reactive again. And as far as the schools go, we can legislate that. And I think we should consider doing so. Thanks.
Yeah.
Thank you for your question and your comment. I think that there are a couple of things at play here. One is that we are seeing, as Meredith said earlier, we are not seeing school spread, and we are not seeing transmission happening in the schools. And we are also getting a certain amount of pressure from the Department of Education that has multiple studies and evidence that that having children in school is really where we should be. So the preemptive closure until after January is something that we can certainly consider. However, we know after having had in-person learning since October, we know that having our children in school is really the best place for them. And we would like to do our best to get them back as soon as possible. So I understand the need and thinking ahead, but we definitely know that in-person learning is the best possible thing that we could do for our students, especially our neediest students, our special needs population. So we are, it may come to that if we are unable to see improvement in the next week or days, but having the option to try to return is something that I feel strongly about. I do understand that we may be seeing something like this happening again after the December holidays, and so that's something I have to consider as well. But I definitely appreciate the comment and certainly will take it into consideration.
Thanks, Michael.
Dr. Dickler, you're up. Just unmute your microphone.
Can you hear me?
Yes, sir.
I just wanted to make one suggestion for the board to think about. We've heard very clearly that transmission is occurring when households mix. And right now, the state's order is that there are to be no gatherings larger than 10. But clearly from Roberto's diagram, and as we all know, 10 would include members of more than one household. So one thing the board could consider would be in order to not have gatherings that included more than one household. Gatherings is different than carpooling. It's different than dropping a child off for daycare. It's being mixing households for a considerable period of time, which is when transmission occurs. So that's one thing you could consider. Thank you.
Dr. Dickler. Sorry. So one of the things that we can definitely do is look into ways to enforce that. It's my biggest concern is just how to enforce that. So let me take the next one. Natalie Seminaro, you're up. Just unmute your microphone. Natalie?
Can you hear me?
Yes, we can.
Can you hear me?
Yeah, yes, we can. Yes.
Can you hear me? Yes, we can. Wonderful. One, I just wanted to. Can you hear me?
Yes, we can. Yes. You might want to mute your video in the background.
One, I just wanted to. Can you hear me? Yes, we can. Yes. You might want to mute your video in the background. Can you hear me? Yes, we can. Yes.
Looks like we lost her.
Okay, we'll try again.
Yes, we can hear you.
Okay, so we're going to try again. I just wanted to thank you for the opportunity to participate in and have all of our voices heard. Please lower that. I hope we can all appreciate at this point and acknowledge the very serious nature of what's happening on our island. And that further, while we are all in this together, the nature of each of our circumstances does vary depending on our differences. So as much as I'd like to believe that right now, this is the time we can filter through those differences, as we are all really depending on all of you to make the best decisions to keep us all safe during this extraordinary storm. And it is a storm. It's one we have not weathered before. It is ultimately up to each of us to make our own responsible choices. But as many of you have voiced just today, Malcolm and Melissa, and your emotional plea to the people watching and to our community members, it's unfortunate that not everyone is doing what they could and should be doing. I know that my deep-seated concerns, and further what I'm about to question, are shared by many of my friends and neighbors. So I'm not only speaking on behalf of myself, but also many people that I am in communication with and that I hold in high esteem. So we obviously have been seeing a shocking surge in the positive cases since Thanksgiving, unfortunately far surpassing the forecasted 5 to 15 per day. So sadly, despite months and months of being clearly told what safety measures we should be doing to keep ourselves safe, and in so doing, keeping our community members safe, there are obviously some living on the island and visiting our island who are still not taking this seriously and thusly following suit. The numbers plainly show it. And what I'm afraid of, one of the things I'm afraid of, is that the numbers don't even really represent the actual number of positive cases. If we take into account any asymptomatic or symptomatic individuals that have not been tested for any number of reasons. Despite many attempts by so many impassioned people in messaging to wear a mask, to social distance, not to gather outside of your own household, not to travel for Thanksgiving, it's clear that such attempts are not working. I mean, let's be honest, and I'm getting to my question, nobody wants to have to wear a mask or neglect themselves from human contact, but right now it's what we must do. So my question, number one, would be, what implications do you see that in any way can tell us, that can reflect that this unfortunate and dangerous trend isn't going to continue right through the Christmas and New Year holiday season? And further, when is the correct time to have, in terms of maybe not a shutdown, but some of the things that we're talking about today, and saying, well, if we recommend you don't go to restaurants, we recommend you don't do these things, but not recommending and saying, no, you cannot, are two different things. So I'm concerned of when are we going to reach that curve when enough is enough. I think we've already reached that, 8 to 10% marker. So I too wish I could be corrected if I'm wrong. And I fully recognize the implications that would put many of us, people, individuals, local businesses, in a place of added challenge and financial stress. So I'm not at all immune to that. I understand it's not an easy decision that any of you have to make right now. But I question, wouldn't we be more in long-term danger of a failed local economy and scarier even yet, growing potential life-threatening circumstances if we don't stop this surge now, as Malcolm said, and I watch all of your meetings, there's lots of talk and all of it is wise, the things that you're saying, but what is going to happen? Because it's obvious, isn't it, that by simply asking people to do the right thing doesn't mean they're going to. Because of what I do every day, can tell you beyond a shadow of a doubt that they do not 100% across the board listen when it comes to the trades. When it comes to the travel mandate that, Melissa, I'm so glad you brought up. In my work, I question. I refuse to see people in person if they have not traveled, but I know that that is not done across the board. And I have lost business because people say, well, I'll go X, Y, or Z, that they will see me. But my life is worth more than that. There are so many of our community members that are at high risk for one reason or another, who still have to go to work each and every day to make a living. These, in my opinion, are particularly dire times for anyone living with such risks or anyone taking care of someone with risks. And can anyone who does not have that as part of the reality imagine what that feels like? Because I can tell you, I can imagine what that feels like. I miss my family more than I can explain. My heart breaks with every missed hug, every missed birthday, every missed milestone, and in just the physical contact that we are all being neglected of. I am not alone in those feelings of being deeply saddened as I watch the numbers rise. It does not, however, change the circumstances. COVID, as we all know, does not care. It does not discriminate. It's doing everything in its power to keep us separated. I know that Nantucket, there are things that we can do to help each other, to help individuals and families. Our island, as Melissa so impassionately said at the beginning, is known for coming together in times of need. So I ask that at this time, all of you consider what I've said, consider very strongly what Malcolm has said, very strongly what Melissa has brought to the table, and consider this with not only your minds, but your hearts. There are a lot of people who are afraid right now and looking for guidance and looking for leadership, and we trust you. So I thank you for your time, and I hope that you can give us some of your thoughts and make a decision, because the decision needs to be made. And I very respectfully thank you. Because the decision needs to be made. And I very
So we'll just take that last comment and then we'll continue. There's only one more. So. Amy, you're able to talk?
Hi, can you hear me?
Yes.
So my quick question is, what is the game plan coming up on the next busiest travel holiday that we have coming up? I mean, it's like insane, the numbers that we're seeing over Thanksgiving. And I feel in my heart that Christmas and everything is a more traveled holiday than Thanksgiving. And are we going to be prepared for what we saw come out of Thanksgiving? Thank you.
So one of the things that we're going to be seeing nationally is multiple surges from Thanksgiving, from Christmas, from New Year's to the 3-day weekends, Martin Luther King Day, President's Day, even Valentine's Day, we're going to be seeing these surges, whether we go into shutdowns or not. And that's one of the things that we're going to be running into. So I'll leave the rest of the meeting to the board, and we can go from here. It's like, even if we shut everything down, it's not going to stop people from coming.
Melissa?
Well, I see your point. I think that's, I feel that that's a little pessimistic also. I know that the cases are going to go up and, but there may be things that we can do. So I would like to, one, I heard today, but just to reinforce that we have a commitment to increase contact tracing and how that's possible, both from the hospital and our health department. And I think I saw nodding heads and that it was possible, but I'd like to leave this meeting confident that that's a plan that's afoot. I've also heard there's a commitment to an enforcement task force. And I support Malcolm's idea that we meet on, whatever the next soonest day possible is, likely Thursday, just looking at the week ahead, and see how these tests come out. But I would also like to see, whether it's from Roberto or committee members, actual tangible proposals for what we're talking about in terms of rolling back or shutting down that we can debate. Because, we're hearing from our health director that there's not a recommendation to do so. And if a board member feels differently, I think we have to have something to talk about. And so I would see that as a path forward, but I don't know what the other board members think.
Malcolm?
Okay, I think I'm live. Yes, I would recommend, and Steve, that we do the following. We schedule a meeting for later this week. We'll have a couple more days of numbers. And I think I would ask the health department to, what's echoing? The health department maybe at a high level drafts some particular recommendations, and essentially the best we can to ban public gatherings of all kinds. Talk about only curbside pickup for retail and restaurants. We can pencil and think about things like gym, salon, theaters, etc. And essentially, I think that's the limit of what we could do is a partial break on things. Of course, if the cases go down in the next 3 days, we don't have to do it. Of course, if we put in more stringent recommendations and the cases go down, we'll all think we're wonderful that we actually stopped it. But it may be just the way it was going to happen anyways. That's the problem. But again, I think we need to, as a board, make a statement about what we're going to go forward with, not just talk. That's my proposal, Mr. Chairman.
Roberto, what do we do that we have no control over the influx of people coming on the High Line and coming on the boats for the holiday? We have no control over them at all. They come and they go. And in your opinion, how does that affect us as far as cases?
I think it affects us tremendously. People are paid. We hear complaints from both sides. We hear that people aren't that masks aren't being enforced on the High Line. Well, when I go on the High Line for a medical appointment, everyone's wearing masks, and it's maybe one or two people who don't have a mask, and they tend to be on their way out anyway to go eat or something like that. So we see it's always anecdotal, and it's very rarely that we have exact evidence. The High Line is doing what they can to enforce, and the Scudders have been really receptive to what we've asked them to do. And I know it looks a lot more packed than it is, but they are still working on a limited capacity. Steamship is voluntarily as well, working at half capacity too. So though we don't have quote control, quote unquote control, they're still working with us as partners. It's the travel that once the travelers get here that we're having trouble. It's their behaviors here that we're seeing issues with. So when you're on the boats, you're traveling through federally regulated waters. So as we don't have control there, but they do, and if they break any of those federally regulated issues, they might be in a lot more trouble than what anything we can do. So it's the behavior that we're seeing here. But we as an island, I've noticed in these past 5 years, we like to say that the off-islanders are doing a lot of things. But what we're seeing right now, this is us. It's those of us who live here. When we hear complaints about the bike paths being dirty, when we hear complaints about trash over in the hiking trails, that's us in the winter. So until we get our own house in order, we can't really be blaming anyone from off island for bringing the virus here. It's us going off island and bringing it back, and then meeting it household to household. We would love to be able to enforce household to household transmission, but it's almost impossible. So we are working to curtail as much of the spread as possible under the regulations we have. We do know that on Friday, the governor's office was recommended to the governor to roll back to step one, part one, which would be a rollback to almost all curbside and almost no retail. And we would have no control over that. So we do also have to see what the governor has to say. But what we can definitely do, if there is direct actions by the board, and we would like to have town council to review them, we can still have a meeting later this week, and not Tuesday, but later we can have another meeting later this week, maybe Thursday or Friday, to discuss specific orders. But in the meantime, I would need those suggestions from you so that we can get them to town council so that they can draft these sorts of orders. Because we as the agents enforce what the board is looking to do. If the board says shut down, we have to enforce shutdown. If the board says curbside, we have to enforce curbside. But we do want to have that be as robust as possible so that we don't end up setting ourselves up for failure. And I know, Meredith, you had your hand up earlier.
I don't think we ever heard, do we have a commitment from the hospital or the town to increase contact tracing at a local level rather than the CTC, since they do not seem to be doing a great job? I know there are a number of people that I've spoken to within the school that have said that they would very happily volunteer to help contact trace some of the people on the island, because as the only person that I work at the school and in the portico at the hospital, I think that's really, if we could contact trace people really quickly, then we may have a better handle on how to do this.
So I think, Mary, if I may, through the chair. Yeah, I think we'll wait to see what the numbers look like. I hear from Elizabeth that she feels quite confident that people are being traced, although there's these anecdotal evidence that that some people don't feel they have been. And I just wanted to before we do consider anything that's too punitive or aggressive, really reiterate what we do know that helps prevent this disease from spreading. It's very simple. And we do know that it works across the country. And when it stops happening, we see these surges, masking and distancing and preventing large groups of people. So we in the hospital treat people with this disease. We're in the rooms with them in close contact, and we wear our masks and our protective gear, and we make the contacts as brief as possible. And we know that that's beneficial and prevents the transmission of this disease from one to another. So when you're out in the world, all of you doing whatever, shopping or working and whatever, be mindful of wearing your mask, remaining as distant from others as possible. And we're very, very happy to see thus far, we haven't had an influx of very sick people. And this has not been overwhelming to our ability to provide health care on the island, which is our main concern. If we get overwhelmed, then we will have to shut down like we did in the spring to providing normal health care to people. So that's one of our biggest concerns. And we would love to keep this contained. I'm hoping, Mary, next week that we start to see smaller numbers. We're all very hopeful for that. But if we need help in contact tracing locally, I can promise you we'll be calling you up and getting you trained, and everybody else who wants to help trained.
Thank you.
Any other questions? I'm having a little difficulty with my audio. Do I sound clear? It's just what I'm hearing in my office. Do we have a specific date for maybe meeting next week if we want to put in some type of, more restrictive orders or rolling something back? Do you want to do it Thursday? If there's time, Thursday?
I think Thursday's a good day. I don't know about everybody else.
Rest of the board okay with that?
Thursday's fine.
Roberto?
Yep, I'm looking at my schedule. Thursday's okay.
Gary?
Gary, you're muted.
I'm so unused to these buttons these days. I just think that you'll probably have 3 days of test results at that point, and if you feel that's sufficient to move something forward, that would be what you'd have. Just be aware of that.
We do need to make sure that this webinar method is available. So pending availability, we could probably do Thursday, but it depends. So once I hear the availability to see if the webinar conference is available, I'll get back to you with times that are available on Thursday.
Melissa?
Thanks, Steve. I just want to recap that though we haven't made decisions on further orders, I think that we have made some strong recommendations and reminders to people that there is a stay-at-home advisory in effect from the governor, that we all must assume and behave as if we have the virus, that to the best of their ability, we encourage our retailers and restaurants to utilize online and curbside as much as possible, and for patrons to ask that of them. I think you'll find that many businesses would rather adapt to that than face a shutdown. And I think a lot of our business community has been responsive, though they have been safe. They have also been responsive to meeting those community concerns. A reminder that workplace has a maximum occupancy of 50%, 10 people per 1,000 square feet. And we're encouraging all of the employers who can allow their employees to work from home to do so. I appreciated Dr. Dickler's comment, although we are not issuing an order, a reminder that your home is your pod and that gatherings with people from outside of your home is not advised. And I think those are really strong recommendations. In summary, I'm not sure if I've missed anything. But I think that those are important for the community to remember over these next few days because, you know, I think the reticence you see in us making decisions is understanding some of the unintended consequences of what an economic shutdown looks like. And I think we all take that very seriously. So I urge our community to follow those recommendations.
Thanks. Does anybody else have any comments? Dawn?
Steve, you do have one more hand raised.
I was just about to say that there's
All
one.
right.
There's one public comment from Brian Sullivan. Bella, you're available, just on mute.
Great. You can hear me now?
Yes, sir.
Thanks for taking the meeting on a Sunday. I appreciate everything you guys have covered. One of the things that resonated to me was the need for contact tracing and it happening on a local level. Well, I appreciate the recognition of personal responsibility. The more contact tracing, in effect, I believe would help with people in their personal responsibility if they understood that they were some way connected to an exposed person or such. Is there a way that this board can take some action today so that when the Board of Selectmen meets, there's a recommendation to create a local contact tracing commission or group, or does it need funding through the hospital, or who could set it up and run it? Is there an opportunity for this board to take action to move that along so it happened at a quicker rate? Thank you.
Thanks, Ellen. Anybody have any comments on what we just said? I mean, I would think that we, you know, here in this community, people could volunteer. Gary?
Yeah, Steve, it's not quite as simple as having a volunteer get access to HIPAA information through medical records. And of course, we've been extremely sensitive in our training, identification of individuals that could help. And we do have an internal collaborative of people that can do tracing. I think we look at how that information then translates into something that's useful to the community. It is how fast can you get into Maven, which is the public health systems tracking system, so that we can also find out what the information means related to how it connects to other households. And I think that at a minimum, what we can do after this board meeting is reconvene with Roberto and his team and talk about you know, what tracing could look like to augment the state's collaborative, and what we would want to achieve out of it, because there are privacy challenges that we're concerned about. There are individuals that would need to have an understanding with some basic medical understanding, and that's what we were looking at when we were selecting individuals and volunteers, mainly physicians and other individuals that we knew had a background in healthcare. That's the way we were approaching it, but we can certainly round it back around and look at that. I think too, looking at the school nurses, I know that Meredith and others that work at the school have a link, you know, for doing tracing and looking at that as well, not just from the standpoint of students, but so doubling down and looking at it would be, you know, a good opportunity at this moment to see where we are and what we can really achieve.
Yeah, thanks for clarifying that. Don, did you want to say something?
Yeah, and I think there's one more public comment. Bob, you're up. Just unmute. Bob? Okay, so it looks like Bob might be having trouble connecting. So we'll just go from, so then let's just keep going.
Yeah, Melissa?
Thank you. And through you, thank you, Gary. I appreciate that effort. I think we all do on the contact tracing. And I think that should be one of the first things we get an update on when we meet on Thursday is what more can we be doing and what that plan looks like. So thank you.
So I just got a text from Erica saying that Thursday, the only times that are available are in the morning with a hard stop at 12:30, or we can do anytime on Friday.
How's the board?
Either day is good for me.
Friday would be better for me.
Both work for me.
Anytime. And Roberto, you mentioned the governor will have new orders on Friday. Yes, no?
The governor might, they recommended to the governor to roll back. The White House the White House coronavirus recommended to the governor to roll back. So we don't know if he's going to be taking that recommendation. So we just have to watch his press conferences because they don't tell us anything until the day of. So
Right.
it's quite frustrating, actually.
So timing it with that wouldn't make any sense.
Correct.
So just whatever's best. It's either day for me.
I'd like to have everybody there, so let's shoot for Friday. So Meredith, that's the day for her.
Friday at what time works best, Meredith? Is it the afternoon or during the morning?
Afternoon would be better if possible.
It's good for me.
Works for me.
Okay, thanks.
Then we'll have another day of testing to look at too.
That's true. So let's see if we can probably just, so that we don't run out of time, should we do also 1 o'clock on Friday if that works? Oh, Gary?
Steve, at the very end, if I could just have a closing comment, but it's all I would ask.
Okay.
And looks like Bob is able to connect again now. So if we can throw him on, if that's okay.
Yeah.
Bob Little? Just unmute your microphone.
Am I up? Can you hear me?
Yep. Yes, we can. And looks like Bob is able to connect again now. Oh, just mute your YouTube. If that's okay.
Okay. So my thought is I really appreciate. Yes?
Just unmute your microphone.
Am I up? Can you hear me?
Yes, we can. Looks like Bob is able to connect again. Oh, just mute your YouTube. If that's okay.
Okay. So my thought is I really appreciate. Yes?
Just unmute your microphone.
Am I up? Can you hear me?
Yes, we can. Looks like Bob is able to connect again. Oh, just Bob. It looks like I have your microphone muted.
My thought is I really appreciate. Yes?
Bob, we muted you for a second because you have a feedback loop with your computer. Just mute your computer first, and then we'll unmute you. Go ahead, unmute.
All right. That's
There we
easier
go.
said than done. Sorry.
We can hear you. Go ahead.
All right. The thought is I really appreciated Diane Pearl's input on using social media as a avenue for contact tracing. Done. Sorry.
We can hear you. Go ahead.
All right. As a homework assignment, I appreciated Diane Pearl's input on using social media as a avenue for contact tracing. Done. Sorry. All right. As a homework assignment, I appreciated Diane Pearl's input.
Melissa, go ahead. I think we're going to have to.
I just see that Bob's unmuted.
Can't hear, we can't get through the feedback loop. So if you can send me an email, I'll get that over to the board.
Okay, thank you.
Thank you.
Thank you. I would just ask that, you know, if we're waiting until Friday to meet with more testing result, but where the ultimate decision making on Friday would be that we were considering some kind of shutdown, I think it's prudent for us to prepare what those proposals would look like now and get them to council to begin to review them, so we don't have to wait to meet for a subsequent meeting for council to join or review. And so again, I'm not entirely clear what specifically we'd be looking at, and if that's a combination of Roberto, your suggestions, and Malcolm and Mary, your ideas. I don't have them. I don't have those answers, but I think it's prudent to get them to Roberto so that we can start to have a sketch of that before to review on Friday's meeting if they are things that we need to implement.
Yeah, we can all do that and just put your thoughts down in an email, what you think, and we could forward them on to Roberto, so at least we have something ready for Friday, potentially. Does anybody have any more? Go ahead, Malcolm.
Yeah, just I read some suggestions. I'll also put them in an email. It doesn't mean we have to implement them all, but I think I agree that we should have each of those written out specifically so we can say yes or no.
Does anybody have any more questions or concerns before I turn it over to Dawn?
Oh, just before you wrap up and as you're thinking about things for the next meeting, I just want to say that, I mean, I'm hoping that this is a bit of a wake up call for the community to just kind of dial back our own behavior. And hopefully we'll see some evidence of that over the next few days. Because, there's only so much that government can do to regulate this and be punitive to people. We've really got to take, and I know that it's a broken record hearing this, you've got to take some personal responsibility and responsibility for those around you. And just go back to your thinking of March and April of how you were handling yourself. I think that people got some COVID fatigue and they got, a little bit of a reprieve over the summer of feeling like things were getting better. And we're almost at the finish line of having a vaccine, but that's going to take many months to roll out and actually become effective. So I just wanted to leave you with those comments. And I hope that as you're thinking about restrictions, they're really specific to how this is spreading and not just sort of knee-jerk reactions to shut down whatever we can control if that's not really where it's coming from. And I am seeing that from what I know, that it's very much coming from people being too relaxed with each other on more personal levels. Thank you.
Thanks. Do you want to take it over, Gary?
Thank you, Steve. I'm just building off of what Don said, so I don't want to, be another broken record. But what you're seeing on this video is a whole host of dedicated leaders that are wanting to do everything they can to keep this community safe, to help us understand the importance of what we're facing. We've all been speaking about it since probably February, and now we're at the precipice. This is the time to double down. You as a community need to back away from one another. You need to take this seriously and not think that because you've had an illness and it's not been significant to you, that it won't kill someone else if they get it. Think about your fellow man, step apart, think about it consciously. I've lost friends. They aren't on this earth anymore. They're part of that 280,000 number that we just think is a number. Those are people with real lives, with real families that are impacted. I know this group will take action if we don't, and they should. It's not the job of the hospital to enforce or make recommendations that would shut this community down, but we want to provide the data so that this group can consider everything to do what's best for us if we can't do it for ourselves. It's in your hands. Please control what you have the ability to control, and have a safe weekend, have a safe week, and move into this time where we can get vaccines that hopefully can take the scourge out of the country and out of the world. Thanks, Steve.
Thank you. Does anybody else have any more comments, any concerns? Malcolm?
I move to adjourn.
Second.
All in favor then by roll call vote as I see you. Jim Cooper,
Yay.
Malcolm McNabb,
Yes.
Melissa Murphy,
Aye.
Meredith Lepre,
Yes.
and Chair Steve Isco says aye. Okay, thanks everybody for coming out on a Sunday, and a lot to think about. So I'll see the rest of you guys on Tuesday and the other board members on next Friday.
Thank you.